Welcome to Dow Chiropractic and Acupuncture. I'm Dr. David Dow, and today what I'd like to do is do a quick deep dive into low back pain. And low back pain is something that it affects 80% of all Americans. Our practice is more low back pain than anything else. And so what typically happens with low back pain is people will start out with a nice, normal, healthy low back, everything's working great, and then they get injured. Injuries can be car accidents, falls, sports injuries, they can be work injuries, it can be chronic wear and tear over time, it can be poor posture over years, and what happens is things start to get worse and worse and worse. And we get a type of injury that's called a subluxation. So subluxation is basically this. We'll get a bone that you get that injury, it shifts out of alignment, and that starts to put pressure on the nerves in there, in the spine. And what a lot of people will do with that pain that's going on because of that pressure on the nerve is they'll take medications. And sometimes those medications work so well that the person never addresses the cause of the problem. And because they never deal with the cause of the problem, over time, things can get worse and worse. So we all start out with a spine that's nice and normal and healthy. That's what this is here. So we've got a disc bone, and the disc acts like a spacer, makes plenty of room in there for the nerve. It's also like a cushion that absorbs impact. And then when you turn your back, we want to make sure those surfaces that come up against the nerve are nice and smooth, and the nerve should be nice and thick and fat like that, and it should be able to move around nice and easily. Then what can happen over time is the spine can deteriorate into what we call phase 2, and then there's a phase 3 even after this, but you can see that the disc has gotten thin. There's not as much room in there for the nerve. We've got a herniated disc or a bulging disc that's called, putting pressure up against the nerve. This is almost bone on bone. We got pointy, rough edges that can be digging into the nerve, and that causes the nerve to die. And when the nerve starts to die, that starts affecting all those parts of the body that that nerves go to. Every cell, tissue, and organ in the body can be affected by that. So here is a chart of the nerves and where those nerves go in your body. This is the lower back. And what we often see in our practice is people will start getting low back pain issues, and that's what brings them in. But as it gets worse, they may start getting pain or numbness in the legs. Now, these nerves in the low back mostly go to the hips, knees, legs, or feet, and that can start off as minor pain that gets worse and worse over time. But a little deeper dive is those nerves also go to 3 systems of the body. They go to the intestinal system, they go to the reproductive system, and they go to the urinary system. And what can start off early on, let's say in phase 1, is maybe some mild intestinal problems. Maybe women are getting painful periods. Maybe there's some bladder problems that might keep you awake at night, so you're not getting enough sleep. And as things get much worse, you can actually get to the point where maybe incontinence issues, maybe infertility, maybe hysterectomies are going on, maybe back surgery, and even taking medications for years and years after that. So the nerves that control the movement of the spine actually come from the neck, and it's possible that an injury to a neck or the brainstem can lead to balance and coordination issues that might be causing your back and other joint problems. Now, I want to teach you some more about this, and that's going to show up in other videos. The next video I want you to stay tuned for. We're going to give you some quick tips and tricks that you can use to help reduce your back pain fast today, right away. So thank you for watching, and we'll talk to you again soon.